I'm pleased to be joined today on Primetime Local News by Stephanie Monroe. She's the CEO of the Lloydminster Region Health Foundation, and we're here today to talk about an exciting new collaboration between the Health Foundation and Catholic Social Services. It's called Border Bridge Counselling Services. Stephanie, can you take me through exactly what this new service is?
It's the border bridging program, which has been generously funded through the donations from the Lloydminster Region Health Foundation, as well as the Lloydminster United Way. So what it's doing is it's actually bridging the gap. A lot of times individuals will call our community counseling services, which are funded through the government, and they will have a significant amount of wait time leading up to their initial appointment. So, we thought, how can we innovatively make this a shorter wait time? We obviously all know that mental health is an absolute epidemic really across the country. And through the social needs assessment done in 2017, we really realized that, our community and locally within our region, we actually have people suffering within our community in a 1-to-3 ratio that have been affected through mental health issues rather than the national average of 1-to-4. So Glenys Coleman was really one of the key players in coming up with this initiative program, and then it went out to RFP, and obviously Catholic Social Services was the winner of that. So they'll be the one delivering the program. So initially what it's doing is it's reducing the wait time that an individual has leading up to their appointment with community counseling. So when you pick up the phone and you call and you make the appointment to go to community counseling, you may only have, they triage everybody, and you may only have a 2-week waiting period, but you also may have a 6, 8, 10, 12-week waiting period. And between you and I and everybody else, we know that we're not making that call because we need help 3 months down the road. We're making that call because we need help today. So one of the criteria for that program is that you have to have an appointment with community mental health, which is a greater wait time than 2 weeks.
The kind of person who this is going to be geared towards?
Right. So this is actually geared towards anyone who makes a call to community mental health. People normally, if you have subsidized coverage through your work plan, or you can affordably afford private for counseling services, sometimes they won't even access community mental health, right? They'll just go and get private counseling services on their own. And that's great for the people that can actually have that resource and can access it. But for a lot of individuals, they don't have counseling services, can be extremely expensive. And so not everybody has the access to be able to provide those services outside of community government funded services on their own. So, by having made that appointment, and if your appointment is greater than 2 weeks time, our hope is that through SHA, through your doctor, through any means of communication, really, we're trying to get the word out through every doctor's office, all the school systems, really just generalized throughout the community that this program is in place. Then you can call Catholic Social Services. They're just the distributor of the program, and they will do an intake. And at that time, our hope is that once you've accessed services through them, that your wait time will be no longer than 1 week.
And then can you talk a little bit about the collaboration between Catholic Social Services, and I think United Way is also kind of involved as well?
Yeah, United Way has been an amazing, and I just, I need to emphasize more and more that this is only possible through the generous support of our donors, right? People that step up and have actually donated money towards Project Sunrise, donated money through the United Way for a program specific to this. So it's definitely an enhanced program. It's not something that you will see in every community across Canada. Like, that's definitely not. So it's innovative, it's enhanced, it's a service that we're providing for the residents of our region because we see a real need for it.
And so if there's anyone out there that's interested in finding more about this service, how can people get some more information?
So they can definitely call Lloydminster Catholic Social Services, as well as calling Community Mental Health and Addictions. So just calling 306-820-6250, and they would be able to, because initially that's the initial intake that you have to have, right? Is making that initial call with community counseling. So as well as our office at the foundation, 306-820-6161, and we'll always point people in the right direction. We get a lot of calls here regarding any health healthcare aspect, really. I think just because we have health in our titles. So, we're always constantly directing people where they need to maybe go for the best resources possible for their particular situation. So we are beyond honored to be able to be a partner in this, and very excited to see what the statistics are at that halfway point. When working with Shauna from Catholic Social Services, she'll be providing us reporting on a regular basis so that we know, as the funders of the program, where the dollars are being spent, and we can relay that back to our donors, because that's such an important part of stewardship. And as a donor myself, that, you want to know that your money is being spent on something that's definitely enhancing the care and well-being of our residents within our community.
It's great to see that this is now here to, like you said, bridge the gap for people. And there's obviously a need here in this region.
Absolutely. And, I just feel like it's so innovative, and it's something that, you're not seeing everywhere. And it's not to replace community counseling. It's not to replace any counseling services that we already have in our community. It's just to bridge that gap and bridge that time in which a person may go even further into a mental health crisis if they're not being able to be treated appropriately.